Thank you, Dr. Schaefer. Thanks everybody for being here. This is a long time coming. I will tell you that I got here 5 years ago, and I was rapidly introduced to the person who's going to follow me, and I'm going to introduce in a few minutes. But Dr. McFarland has had a passion for this for nearly 2 decades. But what let's see.
Slideshow.
There we go. So Dr. McFarland's had a passion for developing a center that represents exercise and the prescription of such for overall health for probably 18 or more years with this, and his partner in crime, Dr. Carrie Stewart, and these two really were spearheading exercise as medicine many years before many of us arrived or were even involved in the science with it. So I just want to really acknowledge that through the work of Molly Murray and Ashley Smith and Kristen Notzel and Meredith Dobrosowski, I appreciate very much how we've been able to come together today. And so I don't have any conflicts, but I do want to disclose that I am a runner. I exercise. I do it for health, and I do it so I can eat. And I was just thinking about how much I like to eat with this. Everything is in moderation, right? So this is not about what I do. It's about what we all do to promote the science and the exercise as not only a discipline for pursuit of patients, but also an exercise as a discipline as pursuit of research and advancing science. And we're very indebted to our sponsors, Stryker, Under Armour, Ed and Carol Anderson, Care First, Blue Cross Blue Shield, and Giant Food. And we also appreciate Wegmans Food Markets. And we'll enjoy our lunch this afternoon. I want to also just acknowledge that Richard Schaefer's been here now 3 years, and Rich Saphir, not to be confused, for the Center of Wellness, and I serve on the Committee for Wellness for Johns Hopkins. And as a sense of why we're talking today, I think I'm preaching to the choir, if we will. All of you are here because you have an investment in this, both in your professional careers as well as your passions. But we know that inactivity is the biggest threat to health across the industrialized world, and it's starting to impact the non-industrialized world, and Dr. McFarland will talk a little bit about that. Inactivity is increasing, and the role of exercise is critical, and we all know this. But what do we think about this? Factors that affect health overall have to do with a lot of influences that we can start. And when we talk to patients, it helps. When we intervene, it helps. When we start to think about some of the more long-lasting impacts, it has to do with prevention of injury, and then really changing the context of the way we think. And exercise, as we know, begins with one step, and over the course of time becomes a habit, and then it becomes a behavior, and it can create a lifelong impact on this. And we know most chronic diseases have some degree of preventability. With nutrition, with weight management, with smoking cessation, all of these are very central to our notion today of exercise, and all of our speakers are going to talk about their fields in expertise and their field of study. And some of those speakers I want to acknowledge today and welcome from out of state. Dr. Fran O'Connor. I'm not going to do introductions because that's Rich's job with it, but we appreciate that you could join us. Dr. Bauman, Dr. Sciamana, who I have not met, coming from Penn State Hershey, and then all the way from Columbia, Dr. John Duperley. So thank you all for gracing us with your presence. We look forward to learning from you with this. There we go, we froze. Now we're going to have an update. All right. So if we take a perspective, as we do when we talk about wellness initiatives in Johns Hopkins, if we look at 36,000 Johns Hopkins Medicine employees, and we look at some of the factors, we can potentially save millions of dollars towards prevention and some of the longer lasting activities. And we do that through health and wellness. And we know that this notion that Dr. McFarland really started thinking about nearly 20 years ago has caught on wildly across the United States. And the trend for national medical fitness is increasing. National fitness industry is a multi-billion-dollar account. In 2018, looking at some of the trends of this, and I think the topics today are going to be wearable technology, weight reduction, what are the risks of wellness in our mental status, what are the benefits of exercise in obesity, and even personal training. But you'll notice that exercise and weight loss is the last trend in consumer-driven fitness across our country. So there is an imperative for us to get the word out for this. So while I'm preaching to the choir, I'm going to just talk about the passion of running for a minute or maybe three. In 2016, there were over 8,000 races that were more than a half marathon. There were 17 million participants. Running is catching on, and it is an exercise, but it may not be for everybody. So when we think about this, the injuries with incidence with running ranges between 19 and almost 80% annually. But we know that running has some tremendous benefits. The Copenhagen City Heart Study showed that even between 60 and 150 minutes a week really reduced cardiac risk. We know also from the Journal of American College of Cardiology that all comers in running at 6 miles a day workout at a 6 mile an hour pace, which is 12 minute miles for 51 minutes, reduces all-cause mortality by 30%. And cardiac mortality by 45%. That's pretty significant. As I think about getting older, I think about knee arthritis, I think about our orthopedic aspects of this, and it turns out that the risk of arthritis is lower when we begin running. This symposium is not about running, it's about exercise, and I think what we'll see is the spectrum of this, but understand that even with running, brain cancer reduction is 43%. So get out there and think about that as we go through. And my challenge is, as we look at initiatives that we currently have within this, and I credit Rich for a lot of the work on this professionally, is that we can do a lot of initiatives, but we have to show the knowledge, the understanding, and the adoption of these plans, of these programs for that, because these are the diseases that are going to be affected by exercise and improved. And so our mission with the Center for Dynamic Health is to improve the health of individuals, communities, in the world by exploring the links between exercise and disease and to foster innovative research, education, and patient care. And our challenge is to emphasize this, to implement this and adopt this into a vision, and to position us as Johns Hopkins in a collaborative leadership role across this science. Now, we do this in a multidisciplinary way, and I think everyone here comes from multiple disciplines, and I hope I've included everybody in the room. But we think about this in a collaborative way. And the rationale is for us to become a coherent organization, and that organization doesn't have walls. I think some people call it a virtual role, and whether it's virtual or whatever you want to define it as, understand that as we as a group of like-minded scientists and clinicians come together, we can begin to leverage research for this. I think the data is clear, but centers designed for collaboration between the clinicians and researchers, centers designed with our patients focused, is really the challenge. So if we think as we have today about a gathering of thought leaders and committed partners, which we seek, we continue to validate the concept of exercise. We develop a sustainable process, and we get sustainable finances for this, because it isn't necessarily a direct money-making process. So our end state is population wellness. I think there's a need for scientific validation in a continued way and sustainability. And so I want to thank you for coming today. I want to thank you all for the ability to open this symposium, and Rich for organizing this, Carrie for driving this, Meredith for coordinating it all of you for being